Welcome to the Alaskaland podcast, stories from the Fairbanks North Star Boroughs past, present, and future, with your host, Mayor Bryce Ward. Each episode, we'll sit down with Fairbanks' most interesting characters for a fascinating conversation about where we've been and where we're going. And now, Mayor Ward.
Hello, everyone. Welcome to another episode of the Alaskaland podcast, where we talk past, present, and future. We're here with Joan today at the Pioneer Museum to talk about a pandemic, and one that didn't just happen, but happened almost 100 years ago.
Yes, I'm so excited to get to do this. Oh my gosh. So a little backstory on this subject. I did the monthly guest stint with Dave Pruz on Problem Corner, and the subject for December, it was the end of December 2019, he asked me, he says, what's our topic going to be? And we were in the grocery store. We run into each other in the grocery store. And he says, what's our topic going to be? And I said, well, I would like to do about when the Spanish flu hit Fairbanks. And he got this horrified look on his face, and he goes, oh, that's such a downer. Right after Christmas, do you really want to do that? And I said, yes, I do. I said, oh my gosh, it's such a good story, you know? And he said, well, okay. He said, that's what we're going to do then. Little did either one of us know what was going to happen in March. Mm-hmm. Just a couple months later, 3 months later, we had no idea when we did that. And it's a really important subject, because the Spanish flu was a worldwide event. And it was actually worse than the current pandemic that we're in now. Worse for a couple of reasons. First is we didn't have modern medicine, ways to treat it that we do today. So we have a few more treatment options. And also worse because there was less understanding, if you can believe that, of what this pandemic was, how it spread, all of that. Ignorance was really much more pervasive than, people worldwide know more about these health issues. And so most people know the Spanish flu came out of World War I. Mm-hmm. And they all think 1918 was the year of the Spanish flu. And it was, but as you saw with this pandemic, it wasn't exactly overnight, bam, sudden, everybody is sick all over the world. It came in waves, and it comes into your community, and it kind of comes in, and there's a few cases, and then there's a few more cases, and then bam, there's a lot of cases. Mm-hmm. And so it kind of moved that way. It was very deadly, mostly in people of middle age, in the prime of their life. Older people had some natural immunities from a prior flu pandemic from the 1880s that had gone through, and a lot of those people were still around. They had some antibodies. So just like with COVID, just because you have antibodies doesn't mean that you can't get it again, but it means that if you get it again, it's not going to probably hit you as hard.
Right.
But you had this whole big group of people who were in their 20s, 30s, and 40s who had no antibodies to this variant of the flu. And it caused these cytokine storms in their systems. Their immune systems would go into overdrive, and it would kill them. And this went through these cities in the lower 48, and cities are densely packed. And as we all know from the COVID experience, avoid the crowds. Well, these cities are also densely packed, and it just went like wildfire through them. And people were dying in such numbers, they couldn't keep up with the number of deaths. We saw that in New York City, where they have the refrigerated vans storing bodies outside of hospitals because they don't have the infrastructure to deal with that many dead bodies. That was just a glimpse into a little bit of what the Spanish flu was like. It was devastating.
And for us in the interior, it was particularly bad because we were at the end of the road.
Well, it was good and bad. We were isolated. So this initial wave of this Spanish flu went through in 1918, and that was the most deadly wave. Mm-hmm. And then there were a couple of subsequent waves, and these were other variants, just like we have the variants of COVID. And some of those were pretty bad for some groups, but not quite as deadly. By the time that Fairbanks got it, it was in the spring of 1920. And the reason for that delay was because of our isolation. Prior to the Alaska Railroad, prior to 1920, we were cut off in the winter. We were frozen in, and the only way in and out was over the trail. And they set up quarantine stations. There were a couple of them along where the Richardson Highway runs today. And the one closest to here would be where Donnelly was. There was a roadhouse, and that was designated as a quarantine station. So if you were coming up here during the snow months, then you were stopped there, and you had to stay there the allotted amount of quarantine time before you could continue on to be sure that you weren't sick. And that worked really well. That protected us. And in the summer months, the flu generally vanished. It was a wintertime disease. So we had that, and that worked for us. But by 1920, more and more people were coming up because the epidemic was waning at that time, and people were starting to move around more. They would come up either up on the Alaska Railroad as far as Nenana or Broad Pass, and then they had to be freighted on sleds after Broad Pass because we didn't have I believe the Hurricane Gulch Bridge wasn't done yet. And then, of course, we didn't have the Mears Bridge done at Nenana either. So right. It would delay them. They had more than a week coming up. So if they were showing symptoms, they couldn't come into town.
Right. And that was long enough to incubate whatever was going on. So it pretty much left us without issue for 2 years.
Woe to you if you came down with symptoms in one of these roadhouses. So that'd be pretty brutal. No medical anything. You just had to tough it out, or, well, if you died, you get buried somewhere. I don't recall reading that anybody died at these roadhouses, though. Mostly in Alaska prior to May of 1920, the flu would rage in the coastal communities, where ships were coming in and out. So in Fairbanks, in the meantime, while all this is going on, we had telegraph, we had newspapers, we had people who would travel, they would winter outside, they would come back in the summer, and they would bring information. And we were very fortunate in Fairbanks to have a standing public health officer already being assigned by the city of Fairbanks. And the health officer had a lot of authority in the matters of public health. And they could declare health emergencies and force people into complying with whatever the health measures were going to be to remedy this. And that came because of the typhoid outbreaks that we would have, and people were getting sick, children getting sick, people dying. You can't have that. So we already had that kind of in place. And Dr. James A. Sutherland was the health officer leading up to May of 1920. And he was a very good doctor. Oh my gosh, he was Canadian by birth, and he had gone to medical school in some of the top schools. He was a doctor who believed in continuing education. He read a lot. He kept up on what was going on, and he wasn't the only doctor like that in Fairbanks. Fairbanks actually had a lot of really good medical personnel. Surprisingly good for the outposts that we were. So while this pandemic was going on, he started learning everything he could about how you could treat people, the issues regarding these municipalities, the mistakes that they made, what worked, what didn't work. And he started coming up with a plan because everybody knew sooner or later it was going to come. So the first thing was he was prepared and he had a plan. And he was able to implement that plan. And that plan was based on public education, and he was going to have to do that in a short amount of time, and keeping people away from each other. He knew that he would need to do that. So he devised ways to do that, and he had gotten people on board before it ever hit, so that he could marshal these forces to step in, and we addressed it in an organized way that was based on knowledge of what worked and what didn't work in other places other than guessing. One of the problems that you have when you wait until a pandemic breaks out is, we're all witnessing this, misinformation. And misinformation came out during the Spanish flu too. In fact, what happens is people panic. They start demanding, you've got to fix this, you've got to fix this, when there's no real way to fix it. And, you've got people panicking, trying to switch the gears of government, of the response to this situation. And it's not that easy always to switch these gears. And an example of that is, one of the things they did was they said, aspirin works really well to treat this Spanish flu. And you just got to give them a lot of aspirin and they're going to get better. Well, what happened was the Surgeon General for the United States got up and said, this is how we have to treat it. This is the best treatment we have available. Well, it turned out that a lot of the people who died during the Spanish flu died because that was the official treatment to give them, and they died of aspirin poisoning. And we saw some of this confusion with the pandemic, the COVID pandemic. Remember when we have President Trump and Fauci and all these other public health officials up there, and they say one thing one day and they say something else the next day, and there's this pervasive confusion, and people start just believing whatever they want to believe. And Dr. Sutherland realized we have to have a consistent message coming from everybody. Mm-hmm. So he did that. He was successful in doing that. The Spanish flu hitting in Fairbanks is actually a tale of two cities. It's the tale of Fairbanks and how we did have an organized response in place, and the tale of Nenana, where there was nothing in an organized response. And Nenana at that time was full of people because this was the construction of the Alaska Railroad. It was way bigger than it is today. Mm-hmm. And you had all these people living in camps, and you had all these people living in these cramped quarters. And there was very limited medical staff available. The medical staff that were there were more geared towards taking care of workplace injuries than communicable disease. So their response was, you just let it happen.
Just let it play its course.
Let it play its course, yes.
Wow.
When it burned through, in the end, Fairbanks came through it with very little death. We lost, I think, like 5 people is all that we lost.
Wow.
It decimated the population of Nenana, and both native and white. And if you go to the Nenana cemetery that's on the south side of the riverbank, across from the airport, down past railroad tracks, you got to drive down this little road. You go to that cemetery and you will see this unbelievable long line of graves, and they all say May of 1920 on them. Mm. And I mean, we're talking, more than 30 or 40 people. And in some of these native villages, the entire village was wiped out. They didn't, they natives really were vulnerable to the pathogen that was responsible for that pandemic. Here in Fairbanks, we marshaled these forces, Dr. Sutherland did, and was so successful. And that's why we survived it, despite a few stupid blunders. So, it still worked. But it was having that plan in place and good education and a consistent message.
So that's definitely what turned the tide then with this early pandemic in Fairbanks, was having that consistent message and having a health officer. I find that really interesting. I mean, that time was also, the town was relatively new, only 15 to 20 years old-ish.
He saved us.
That's amazing.
He really did. He was quite remarkable. So when it started, it arrived in town. People would leave in the winter, just like they do now, and then they would come back up for the summer work season. And with the workers, not all the workers were men. We had workers that were women too. And there was this, the Brower stage arrived. This was just so interesting. I looked in these old newspapers and I started watching who was coming in and who was leaving about the time that this took off. And they actually attributed, they got it down to one stageload of passengers that brought the flu to Fairbanks. And it got this little mention because nobody knew the significance of it at first. But later on, it had a huge impact. So the Brower stage arrived in town. They came up the Valdez Trail, which is where the Richardson Highway is today. And they arrived in April, and they had 9 passengers on the stage. And sitting behind you, it would have been like that wagon, only with runners on it. They would take the wheels off in the winter and put runners on. So it looked very much like that. And these 9 people were on there. And of these 9 people, there were about 5 ladies who were not the regular ladies of Fairbanks. And these ladies were up here to work because the paychecks were rolling in. And these ladies went north of town, somewhere in the area of Fox, and that's where they set up shop. And they were all prostitutes. And just about 10 days later, 3 camps, full work camps of men came down sick all at once with the Spanish flu. And Dr. Sutherland had to act, and he had to act fast. And he had already he had agreements already made. If it ever comes, we're going to use this building as a quarantine hospital. We're going to use this building as a quarantine hospital. He had those already worked out. So he had these men brought into town on the train, and they were quarantined. And, that would have really worked, and it would have protected Fairbanks. I think that it would have really nipped it in the bud, and it would have been less of an issue than what it ended up being, except that there was one mistake made. The municipal elections were in late April, and they had the municipal election, and everybody voted in those days. I mean, everybody voted. Why, if you didn't vote, there was something wrong with you. That was a public event. You had to be there. You had to be seen. So everyone in Fairbanks showed up to vote. And about 10 days later, everyone in Fairbanks got sick.
Oh, wow.
And then it got spread to Nenana, and it got spread to some of the outlying places, Live and Good. They set up nobody in, nobody out. We don't care. You're going to live without everything. We are not going to let this come, because they were sitting ducks. These outlying camps, if you didn't have that kind of an attitude, a real aggressive response, once it got in there was no treatment available. You just had to write it out, just like if you were at one of these quarantine roadhouses. So they they had these quarantine hospitals, and then everybody in town got sick. And so he had a network, and boys, because kids didn't get it. It was people in their 20s, 30s, and 40s who were the most vulnerable to this. And he had a network of boys who weren't sick. And they carried supplies and messages from place to place. So they would go and get the groceries and take them over to this house and beat on the door and leave them on the porch. They would take the needed medicine over to this other house. And he had these boys running on foot and on bicycles doing these deliveries. And he later had an article written in the paper giving thanks to these boys that really stepped up when the town needed them. And what a great thing. He also had the editor of the newspaper on board, and every day published would be these informationals, what to do. If someone in your house gets sick, what to do about that, how to care for them, how to protect the other members in your house. He did that, gave very consistent information. Masking was not something that people did, but he set out to interrupt people congregating in groups. There was a curfew set up in town, and if you broke the curfew, you went to jail.
Oh, wow. Pretty serious.
You went to jail, yes. So after curfew hours, you were not to leave home. You had to stay in your little family unit. There was, if you went to the store, there wasn't very many people in there at one time. People were really limited about that. Masking was something that only medical staff did. I didn't see any evidence of masking amongst the general population in Fairbanks.
But it seems like distancing was still a pretty big part of that, though,
Yes.
by limiting folks going into stores and this curfew where you could go to jail.
We had one super spreader event, the election, and that was the end of the super spreading. And, so that was the end of that. And then everybody who had it had to get over it. But there were treatments available, and the doctors, he organized them and they went house to house rather than people going to the hospital. They just treated them at home. Mm-hmm. And they would go in and they would wear masks, they wore protective gear, and they would go in and treat these patients. They also recruited nursing staff that didn't have to be a certified nurse. They would recruit, they would teach you what you needed to know to care for a flu patient, basic care. And they would come in, because sometimes these homes, the whole family would be sick, and there was nobody to care for these people, and that's where these volunteer nurses would come in and do that.
Wow.
And it was very successful. Nenana, on the other hand, was people were dropping like flies. There was no care. It was really, really desperate and sad. And the doctor that was there, the town doctor, was just inadequate. He didn't have a way to even address it. So Dr. Sutherland, as he saw the tide was turning in Fairbanks and that the flu was waning here, he marshaled 14 people, volunteers, and they took a special train to Nenana with medical supplies, and they went down and they started treating people in Nenana and setting up quarantine hospitals and all of those measures, and they finally got Nenana past the flu. And those 14 people were just regarded as saints, and they were people from all walks of life.
So the doctor knew that he had to have consistent messaging, communicate it well with the public, and then have these things prepared ahead of time. So it's interesting how we look at the pandemic. As it's unfolded for us here in Fairbanks and really across the world, and how some of those things would have been really great things to practice.
Yes. Well, he had a plan and he had agreements with other people. So he had, his top people that he needed to implement the plan. Mm-hmm. And he had them educated and all on the same page. So they had an organized response to it. One other very interesting thing is I happened to be sitting in Dr. Sutherland's office chair for this interview. This is his chair.
Maybe let's talk a little bit about that, because it's a fascinating piece of furniture.
Yes, it's part of our collection here at the museum.
So if folks are interested to see this, they can come down to the Pioneers Museum, check this out here at Pioneer Park.
Yes.
And I guess maybe what's the story? How did this end up in the museum, this bit of history?
Well, Dr. Sutherland was a pioneer. He was a member.
Was a member of the Pioneers?
Oh, yes. The Fairbanks Men's Igloo has been here since 1909. The women's have been here since 1916. We've been active in this community all along.
That's amazing.
Yes. Yes. The Pioneers of Alaska have had people other than just ordinary people. We've had people who have served in all civic offices. We've had people, Judge Wickersham was a pioneer. The territorial legislature used to be made up of mostly pioneer members, members of our organization. And we helped to build Alaska and Fairbanks into what it is today. It's quite a legacy.
That is truly phenomenal to see that history of the organization and how you've been able to capture the history of Fairbanks through these pieces like the furniture, like the chair you're sitting in from Dr. Sutherland, and then other pieces throughout the museum here. So you could probably spend a whole day in here. I love the dioramas. I love the pieces that they tell stories.
We have the wheel from the Lavelle Young. That was the wheel on the boat when E.T. Barnett was kicked off the boat. That wheel was here the very first day that Fairbanks was discovered. We have Felix Pedro's gold scales here. They were his actual gold scales. We have a lot of really neat stuff.
Well, if someone wants to come down and be a member, it's we talked about this in an earlier episode, but just for folks maybe that are tuning in now, you have to be 20 years old to be a member. Come down to the museum, talk to some of the staff, talk to a pioneer. If you're interested in a bit of history, from a previous episode, ask them about the rats.
Yes. Well, you can also go to our website. We have the history nuggets are posted on our website. I think we've got more than 100 of them on there. And that's at pioneersofalaskafairbanks.org. And if you're interested in becoming a member, we have information on there on how to go about doing that. And,
Well, that is absolutely wonderful. And Joan, thank you so much for taking the time to talk with us today about the Spanish flu. And to talk about the museum. And just we encourage anyone to come down if you're listening to this and you want to know a little bit more or know about Fairbanks history, come down to the Pioneer Museum here at Pioneer Park.
Well, it's my pleasure.
Great.
Yes.
Thank you. And thanks everyone for listening.
Fairbanks, oh Fairbanks. Thanks for listening to the Alaskaland podcast. We hope you found today's conversation enlightening. For more episodes, listen on your mobile device through your favorite podcast app or watch at youtube.com/Fairbanks North Star Borough.